Vascular Patterns Part 2. We have talked about vessel morphology, but now we have to talk about vessel arrangement. No matter if the vessels appear as dots, clots, or lines, they may be arranged in different ways. The most common arrangement is no specific arrangement at all. We call this a random arrangement. You've seen this case already. Clinically, dermatoscopically, we have dotted vessels, but the arrangement of vessels is random. There is no specific arrangement at all. Here's another example of another lesion. Clinically, dermatoscopically, now we have linear vessels, not dotted vessels. Some of them are looped, some of them are coiled, some of them are even serpentine, but the arrangement is random, not specific. B. This arrangement is called clustered. What do we mean by that? It occurs when in some parts of the lesion the density of the vessels is more dense than in other parts. For example, in this case, clinically and dermatoscopically, we have clusters of dotted and coiled vessels here and here. This is clustered arrangement. Sometimes it's difficult to differentiate between clustered arrangement and random arrangement. If you're not sure, assume that the arrangement is not specific, just random. C is a peculiar arrangement of vessels. We call it serpiginous. It mainly consists of dotted vessels or coiled vessels that are arranged in lines. The lines are curved and serpentine. This is a common pattern in clear cell acantoma. Clinically, dermatoscopically, you can see large dots or small coils, whatever you prefer. It's not important. Important is that the arrangement is specific. The dots or coils are arranged in a serpiginous arrangement. D. We call this arrangement radial. It occurs with linear vessels. Mostly the vessels can be linear straight or looped or even serpentine. Doesn't matter. What's important is that the vessels are arranged in a radial way, do not cross the center, but the direction of the vessel goes from the periphery towards the center. Here's an example of a molluscum. Clinically and dermatoscopically, you can see linear vessels. Some of them are straight, some of them are looped. Doesn't matter. Important is that the arrangement is radial, do not cross the center, and the direction is from the periphery towards the center. Here's another example of it's not a molluscum, it's a seborrheic wart, but you can see here looped vessels at the periphery, and the arrangement is radial. This arrangement is rare. It's the reticular arrangement of vessels. It corresponds to the reticular pattern for pigmented lesions. I have one example here. Clinically and dermatoscopically, you can see linear vessels in a reticular arrangement. This arrangement is very common. It occurs with serpentine vessels, and we call it branched arrangement, which means that from a thick serpentine vessels there are many thinner serpentine vessels branching off. This is an example. Clinically, dermatoscopically, you can see linear serpentine vessels in a branched arrangement. So branched serpentine vessels. In the metaphoric language, they're called arborizing or tree-like vessels. Here's another example. Clinically, dermatoscopically, linear vessels, but we have more than one band. They are serpentine and they are branching. So branched arrangement of vessels.